We are hooked, a nation addicted to drugs. This epidemic is currently afflicting over 17 million Americans. We were looking for a quick fix to make us forget about our problems, and we found it. We found it in the form of a pill, a small tablet that would make the downtrodden and depressed find a high to get them through. Made in a lab to cure the despondent, the side effects include hallucinations, anxiety, vomiting, memory loss, and suicide. We found the solution in antidepressants. Since 1988, the use of antidepressants has increased by 400%. More specifically, between 2005 and 2008, when the number of prescriptions nearly doubled. This is partly because doctors felt safer prescribing medication to help their patients, as pharmaceutical industry claimed that the newer generation of antidepressants left the users less prone to suicide. Somebody should probably tell the side effect labels that. But severe depression isn't the only side effect of taking antidepressants. Those who are on them may also experience weight gain, insomnia, dry mouth, nausea, irritability, and anxiety. Out of these immediate effects, those who are on these pills also run the risk of dependency. 60% of them have been on them for more than 2 years. This would be less unsettling if quitting didn't give off withdrawal symptoms similar to that of longtime drug abusers. Stories of those trying to get off antidepressants experience crippling stomach pains, debilitating headaches, dizzy spells, and extreme cases, hospitalization.
The number of people prescribed doubled in the past decade alone, as doctors have found other ways to get these drugs to their patients. By using them to treat a variety of other ailments other than depression, the profits of the antidepressant industry have skyrocketed. By using these pills to treat back pains, sleep loss, and fatigue, American medicine cabinets were filled even faster. So are these risks worth it? Is this cure-all remedy worth the hazards? Maybe if the third-party studies back the findings done by the companies pushing these drugs. Irving Kirsch and Dr. Walter Brown conducted private studies showing that antidepressants serve as little more than a sugar pill, a placebo that, even in studies done by the big pharma companies themselves, only help about 14% of their patients. Why would the pharmaceutical industry and doctors want to sell a pill with so many drawbacks? Maybe it's because these companies boast an astounding $11.3 billion in revenue in the United States alone. In 2005, 4 of the top 10 most prescribed medications were antidepressants. Meanwhile, we're seeing a shift from getting mental health treatment from mental health professionals, as doctors seek to give their patients pills before recommending therapy and other alternatives. Less than a third of those currently using have seen any sort of mental health professional in the past year, relying on medication to cope.
Is the growth of this industry due to people being more depressed than their counterparts from 30 years ago? That's one way to dismiss the 400% increase. Or we could look at how companies market their drugs to patients. Drug companies can give doctors who prescribe their medications pens, gift cards, trips to the golf course, and even hundreds of thousands of dollars to promote and push their product. They fund their flights to conferences and cater their meals. Doctors are in the pockets of large, multi-billion-dollar companies. They can even check up on the doctors they're funding by buying prescription histories. The financial future of these physicians is completely dependent on their ability to serve their sponsors. The pharmaceutical business is a business like any other, with the highest bidders taking first place. Capitalism comes with consequences. The pharmaceutical market, you would assume, would serve for the betterment of society, but this might not always be true. People use antidepressants and other drugs to help them trudge through their own problems, but depression has become a very light term. These drugs come easily to those who want them, and the people might not necessarily need this drug to get themselves better. As in any market, it's profits over people. The antidepressant industry, designed to improve the lives of their patients, is no exception to a system that caters to those on top. There are safer ways to solve depression than buying into a cure-all drug that invites its own problems more than it's worth. Seek therapy over medication, talk to a loved one, spend time doing what makes you happy. The cure to depression isn't going to come out of a bottle. We have been deceived, and awareness is the only solution.